The Rivers State government, through the Ministry of Health, has organized a stakeholder implementation sensitization meeting on the Rivers State Contributory Health Protection Program for healthcare workers in the LGAs. Addressing the stakeholders and healthcare providers, the State Commissioner for Health, Dr. Adesi Ores, said the State Contributory Healthcare Protection Program is part of efforts in achieving universal healthcare coverage by providing financial risk protection for all Rivers people, especially the vulnerable population. Dr. Ores says the approval of the implementation of the Rivers State Contributory Health Protection Program, RIVCHPP, by Governor Siminalayi Fubara is not something that should be taken lightly and for granted, as it is for the benefit of Rivers people. The Commissioner made this known at the RIVCHPP Basic Healthcare Provision Fund, BHCPF Implementation Sensitization Meeting held in Port Harcourt. Dr. Ore recommended the Acting Executive Secretary, RIVCHPP, and her team for the efforts, adding that they have been able to enroll over 36,000 persons within 3 months in the program. She added that the Health Protection Program cannot work without the collaborative efforts of everyone.
The Rivers State Contributory Health Protection Program is our program. And when I say our, I am not speaking about Rivers State government. I am speaking about the people of Rivers State. Citizens, residents, business people in Rivers State. Collectively, we can make it work. It cannot work if we don't put hands together to ensure its success. The success that we experience in these facilities accessing this program is what will translate to more people voluntarily enrolling and getting on board with this program.
On her part, the Acting Executive Secretary of the RIVCHPP, Dr. Vetty Agala, noted that the Basic Health Provision Fund, one of the plans the RIVCHPP is implementing for the poor, vulnerable people, pregnant women, persons living with disabilities, amongst others, adding that the criteria for enrollment for the vulnerable people is the National Identity Number, NIN.
What we want people to know is that the Basic Healthcare Provision Fund is one of the plans that the Rivers State Contributory Health Protection Program is implementing. And that plan is for the poor and the vulnerable people in our society. And they include pregnant women, people living with disability, widows, children under 5, adults over 60, and even some people with some chronic illness like HIV, sickle cell, because we have engaged with those set of people and we found that there is a gap and they need to access care for other things that are not already paid for. We also want people to know that this health insurance in Rivers State is not just for poor and vulnerable people. Civil servants, both at the LGA level, both at the state level, can also access it through the formal sector plan.
Dr. Agala, while highlighting some of the packages for civil servants in the state, local government level workers, she emphasized that individual residents in the state can also enroll as long as it meets the requirements.
Those in the informal sector, you don't work for anybody, you work for yourself, you own a small company, whatever, you too can access healthcare. We have packages that are corporate for companies, but we also have individual packages of 15,000 naira. So a regular person who does his markets or a driver, you can buy a plan for 15,000 per year and access all the health services that are common to us in our environment, including maternal and child health care services, including hypertension, diabetes, all of the regular things that our people are sick of.
The state coordinator WHO in Rivers State, Dr. Giwa Abdul, assured of giving technical support training to all levels of healthcare providers under the RIVCHPP. Dr. Vetty Agala further stated that the vision of the program is to be the premier state in social health insurance provision in Nigeria and Africa, delivering premium financial risk protection to the people of Rivers State.
Health coverage as one of the targets